The Atlantic slave trade was the backbone of economics in colonial America. Because so much money was on the line, plantation owners relied heavily on physicians to take care of the health of their workforce composed of slaves who experienced terrible health conditions on a daily basis. In order to understand the need for medical care for slaves in America, it is important to first consider the conditions that existed during the time of slavery, which was in the 17 and 1800s. People who lived in areas where slaves were kept, such as the Old South, were subject to most of the illnesses that others in the United States suffered from. Medical conditions such as tuberculosis, whooping cough, yellow fever, malaria, and cholera are but a few of the diseases that affected those living in the Old South. During the 1700s and 1800s in America, white physicians studied black slaves and their descendants in an attempt to identify characteristics that were distinctive of their race. They believed that all questions about health could be answered by examining the body. By using this logic, if African Americans had worse health outcomes than white people, the differences had to be due to genetic racial weaknesses instead of being due to disparities in social and economic class. White physicians actually came to view blackness as a metric for gauging health and sickness. A Southern physician named Dr. Samuel Cartwright believed that the size of black people's brains was a ninth or tenth less than in other races of men, while black people's hearing, sight, and sense of smell were better. However, physicians during the 17 and 1800s provided insufficient health care and exhibited a general lack of concern for the health care of the slaves. In the Slavery and Medicine primary source put together by Catherine Banco, a former slave named Amy Perry, states that the medicine I remember was castor oil and dogwood and cherry bark, which they put in whiskey and give you. They give you this to keep your blood good. Dogwood will bitter your blood. It good medicine, I know. Another common method of treating an illness during the 17 and 1800s was a method called depletion. This method involved draining the body of what was believed to be harmful substances that were causing the slaves to be sick. The different ways of depletion included bleeding, sweating, blistering, purging, or vomiting. The physician's treatment plan often included calomel, which served as a drug to cleanse and purge the body. This type of cure was usually just as deadly as the illness, which helped sustain slavery in America, as many slaves were reluctant to seek health care as the chances of them actually getting better was extremely low. Some physicians associated specific diseases with slaves, such as cachexia africana, which means dirt eating. In an attempt to control the presumed practices of slaves eating dirt, physicians and plantation owners implemented techniques such as using mild purgatives, threats, punishments, iron masks or gags, cutting off the heads of those dying from the practice, and other harsh responses. In 1808, a federal ban on importing slaves had a ripple effect on American medicine. After that ban, slave owners had a great interest in making sure slaves gave birth to healthy babies, since they couldn't import new slaves. However, slave owners didn't take care of pregnant slaves as they were not taken care of during their pregnancy. Enslaved women suffered from many of the same reproductive health problems as did white women, and it is believed that about half of slave women's pregnancies ended in stillbirths. In addition, exhaustion from the physical demands of slave labor had been blamed for negligence in childcare that may have resulted in sudden death in infants. Slaveholders typically demanded that women who had just delivered babies return to the fields almost immediately, and if they refused, they were whipped. Slave women often rebelled against their masters by relying on an interesting array of birth control methods. Examples of these birth control methods included holding a brass pin or copper coin under the tongue during intercourse, drinking concoctions such as gunpowder mixed with milk, or swallowing 9 pellets of birdshot. When birth control methods failed and an unwanted pregnancy occurred, enslaved women turned to other measures to terminate a pregnancy. By terminating a pregnancy that would have resulted in an additional worker for the slave owner, and by utilizing a cotton plant to perform the abortion, the female slave was exercising some control over her body and her enslaved situation. For most enslaved women, they were expected to return to work shortly after having their babies. One unidentified former slave from Richmond County, Georgia recalled that whenever a child was born, the mother comes out in 3 days. Afterwards, if she was healthy but nobody stayed in over a week. They never stayed in bed but one day. The healthcare system in the Americas during the 17 and 1800s did nothing to help the lives of slaves, as, instead, it actually helped the system of slavery continue to prosper.